Hello, I wanted to show you guys a trick that you can do at home if you are having trouble deciding if your sensor should move anterior or posterior. So if you take a Post-it and you cut a space out in the center that is roughly the same size as your sensor, so about maybe 1" by 1.5" rectangle. This isn't quite it, obviously, but something close. And then if you have printed out or even on your phone, you could lay this over your phone. And when you're looking at one film, let's take this film for example, and when we put it over the film, you look at it and you say, okay, well, this is a premolar bite wing, and I cannot see the distal of the canine. So if I were to move my sensor posterior, I'd be seeing even less of the premolars, and I'd be getting farther away from the canine. So if I moved my sensor anterior, it would be revealing more of the canine. So I know that by shifting my little view window anterior, I know that that would be revealing more of the anterior teeth, and that would show me the distal of the canine. Now for using it with the molars, I'm going to find one where the second molar is. So let's use this one down here. This is a good one because the second molar is way toward the back of the film, and we want the second molar to be centered in the film. So if I use my little viewfinder and I say, okay, if I move my film more anterior, then I'll be seeing less of the second molar. If I move my sensor more posterior until my second molar is centered in the sensor, then I know I have to move my sensor backwards or posterior. So this just so you can move your little viewfinder to help you determine if the sensor needs to go anterior or posterior.